patients with epilepsy include gliosis and gliosis with hamartia, which usually shows small abnormal structures that cannot be captured by MRI. Although it is difficult to visualize these lesions with neuroimaging, it must be remembered that for patients with severe epilepsy and clinical EEG evidence indicating the presence of unidentified epileptic areas, surgical intervention must be performed after negative MRI. Patients with clear postoperative histopathological findings have better outcomes than patients without clear causes. Therefore, all available clinical data should be integrated and evaluated to determine the most appropriate treatment for each patient, especially for those atypical manifestations. Our last topic is the new advancements in MRI technology and future developments. First, we will shed light on the emerging 7 Tesla MRI. Ruber and colleagues believe that the new developments in imaging hardware, sequences, and data post-processing are the main driving force for the advancement of epilepsy MRI research. Regarding the new technologies, the first ultra-high field 7T MRI scanner was approved in 2017. It extremely improved resolution, increased signal-to-noise ratio, and reduced scan time. 7T MRI should be a boon for epilepsy imaging and evaluation. The key research supporting this application shows that compared to 3T imaging, the advantage of 7T MR is that it identified 6 out of 21 epileptogenic lesions in patients with focal epilepsy who were MR negative on 3T sequences. However, these benefits come at a price. 7T MRI has its own unique challenges that must be considered by clinicians, including distortions and artifacts that impair imaging accuracy. For example, FLAIR imaging, which has shown the greatest utility in the evaluation of epilepsy, is especially hard to implement due to limitations in the absorption rate and long relaxation times. Now we move to quantitative MR via relaxometry. The novel sequencing methods aim to standardize the evaluation of biological and physiological characteristics captured on MR images. An interesting recent development involves the use of quantitative MRI through a technique called relaxometry. Relaxometry is a method of measuring relaxation times from MR images. It is performed by capturing a series of measurements of one variable parameter, such as flip angle, inversion, or echo time. Relaxation times, such as T1, T2, T2 star, proton densities, or susceptibility sources can then be analyzed as functions of the signal changes during the sequence, regardless of the hardware differences and the operator's evaluation of the region of interest. Pilot studies of quantitative MRI using relaxometry succeeded in patients with epilepsy, showing that the automated protocol for determining hippocampal T2 values in hippocampal sclerosis patients is accurate, reliable, reproducible, and superior to manual evaluation. Other sequencing strategies are also promising. Let's take a quick look at those. Other new sequencing strategies that have shown promise in epilepsy include double inversion recovery, which improves the contrast of gray white matter, and diffusion-weighted techniques. One such method, combining high angular resolution diffusion imaging with innovative post-processing algorithms, such as pixel-based morphometric analysis, produces encouraging results by increasing the sensitivity and interpretability of fiber densities in areas adjacent to the epileptic foci. Last but not least, we'll look at future developments in MRI. Other post-processing strategies are also being explored. These methods replace the analysis of the volume and shape of the cortex and subcortical structures to assess morphology. The asymmetry of neuroanatomical shapes has been studied in cortical and subcortical brain regions, and it has been shown to predict neurological diseases, including epilepsy. A study used multimodal 3T MR profile analysis, which combined morphology, intensity, diffusivity, and functional connectivity features to characterize focal cortical dysplasias of type 2A and 2B. The profile-based classifier predicted FCD subtypes with a sensitivity of 85% and a remarkably high specificity of 94%. Relative to healthy and diseased controls. In summary, the continuous development of research on the structural and functional MR features characteristic of discrete pathologies has proven potential advantages of computerized classifiers that integrate multiple modalities. In the future, standardized imaging examinations may produce individual 4D patient data sets containing multiple co-registered 3D topographic volumes from several imaging modalities, the body of which can be evaluated by a validated computerized classification system. More importantly, anatomical models of connectivity may play a potential role in the diagnosis and preoperative evaluation of epilepsy. This research on connectomics is exploring the hypothesis that epilepsy is a systemic pathology, not a consequence of a single local abnormality. Since the nodes and structural, perhaps functional edges of an ictal network are depicted, it may be possible in the future to determine the best graft cuts for each patient before surgery. Finally, in addition to trying to describe the anatomical features of epilepsy, researchers are also trying to picture the seizures as they are. Although in most cases it may be impossible to observe seizure events in real time, post hoc visualization of the microstructural processes activated during a particular seizure may be achievable using a sensitized MR signal that targets the neuronal correlate of transient MR features. In this regard, an interesting strategy involves the use of arterial spin labeling to map post-ictal hypoperfusion. Additional research may even produce dysfunctional imaging or the possibility of capturing seizure traces. Additional research may even produce dysfunctional imaging or the possibility of capturing seizure traces and its characteristic features long after the event. If this function is realized, the value of seizure imaging may become equal to that of epilepsy imaging itself.